Did you know that medical errors are one of the leading causes of death in the United States? But beyond that human tragedy, there's another crisis happening behind the scenes, costing hospitals billions. The culprit: tiny mistakes in medical coding. Every time a procedure is missed or a diagnosis is misclassified, insurance claims get delayed or denied. Healthcare CFOs are asking a critical question: can AI stop the financial bleeding before it's too late? The answer is yes, and it's already happening. In 2022, a quiet revolution began at the Mayo Clinic. They deployed a deep learning AI that could read doctors' notes and automatically turn them into accurate billing codes. Within 6 months, the AI was over 95% accurate, working 60 times faster than a human team. The doctors didn't have to change a thing. The AI just worked in the background, a silent, super-efficient coder. This process is part of what's called revenue cycle management, or RCM. Think of it as the financial lifeblood of a hospital. In the US alone, there are over 35 billion healthcare transactions every year, and coding errors cause about 30% of all denied insurance claims. Globally, that adds up to over $100 billion lost annually. It's a staggering amount of money, all leaking through the cracks of a system that was simply too complex for humans to manage alone. By 2023, medical coders were at their breaking point. A single patient chart can be over 50 pages long, filled with complex notes and lab results. Translating that into a precise combination of codes is incredibly difficult, especially with staffing shortages. Error rates were climbing, and hospitals were losing millions, not because people weren't working hard, but because the sheer volume was overwhelming. This is where the real game changer came in: AI that could actually understand medicine. Using natural language processing, systems from companies like Fathom and Amazon HealthLake began to read and interpret clinical notes just like a human would. But they did something even better. They learned from their mistakes. Every time a human expert corrected the AI, the system got smarter. This wasn't just automation, it was adaptive intelligence. Let's look at a real-world example. In 2024, Intermountain Health, a huge hospital network, integrated an AI coding system across 20 facilities. The results were mind-blowing. The time it took to get claims processed dropped by 70%, coding productivity tripled, and denial rates fell below 2%. They saved over $20 million in recaptured revenue. And the best part, no one lost their job. The AI handled the repetitive tasks, freeing up human experts to focus on complex audits and improving documentation. Of course, this shift has its critics. Can we really trust a black box algorithm with something so important? What if it misses a subtle detail in a cancer report? That's why the key isn't replacement, but augmentation. As one expert put it, AI is like an autonomous co-pilot. It flies the routine routes, but humans still steer through storms. And this revolution isn't just happening in the US hospitals. From Abu Dhabi to Singapore are now using AI to standardize their billing and improve accuracy, even across different languages. The results are universal: faster payments, fewer errors, and a stronger financial foundation for healthcare everywhere. So here's a bold prediction. By 2030, 90% of medical coding will be driven by AI. Human coders will evolve into AI quality auditors, managing the systems and ensuring everything is ethical and compliant. We might even see real-time billing, where a claim is submitted the second a doctor finishes their notes. For medical coders, this change is a mix of relief and anxiety. But the story so far is one of empowerment. AI is reducing burnout and allowing people to do more meaningful work. It's a powerful example of how technology can strengthen, not replace, human expertise. The story of AI in medical coding isn't just about finance. It's about creating a more efficient, sustainable healthcare system where financial precision helps save lives. Thanks for watching. If you found this look into the future of healthcare fascinating, don't forget to like, subscribe, and hit that bell for more videos.